Hi there. My name's Jesse. I'm in group 7 with Cody and Tracy. We chose furosemide as our drug of choice. That's the generic name. And it's also a brand name known as Lasix. It has side effects, just as every other drug does. The most common side effects for this medication are the headache, dizziness, and blurred vision. Now, it does create some ringing in your ears, and if progressed with higher doses, it can create hearing loss. The fever and rash type things are severe allergic reactions, and those are things that obviously you want to notify your doctor about. They're not things that happen very often, and then usually tends to happen through IV. It does cause hypotension, and that is because it is working to lower blood pressure as well as dropping edema.
Furosemide, a loop diuretic, is a water pill that is designed to reduce excess fluid in the body. It is indicated in edema associated with heart failure, liver cirrhosis, and renal diseases. Edema is a condition where the capillaries leak fluid into the interstitial spaces as a result of high hydrostatic pressure. In heart failure specifically, the chambers of the heart lose their ability to effectively pump blood throughout the circulatory system, so the blood pools in the legs, ankles, and feet, which then causes pressure to rise and therefore fluid to leak out of the capillaries. In liver cirrhosis, the blood cannot easily flow through the liver, therefore increasing the pressure in the portal vein, which leads to fluid buildup in the abdomen, also known as ascites, in addition to the fluid that builds up in the legs. And finally, in renal failure, there is a loss of the protein albumin in the blood, which causes fluid to accumulate in the interstitial spaces. Normally, albumin compromises about 75% of normal colloidal oncotic pressure, so when levels are low, the osmotic pressure generated albumin cannot counteract the hydrostatic pressure, therefore leading to edema. And finally, another indication for taking furosemide is hypertension. If the pressure within circulation is high enough, it can lead to damage of the blood vessels and eventually atherosclerosis. So by taking furosemide, we are able to decrease the fluid accumulation in the body and decrease the risks and complications that are associated with all of these conditions. And patients that are taking furosemide should be wary of the fact that it is a potassium wasting diuretic, meaning that potassium is lost in the urine and should be supplemented in the diet to avoid complications that might arise with hypokalemia.
There are several adverse effects that can occur when taking furosemide. Furosemide can produce an excessive loss of sodium, chloride, and water in the body, potentially leading to severe dehydration. Tell your doctor if you have dry mouth, unusual thirst, and decreased urine output, and make sure you are drinking enough water. Furosemide can also produce an excessive loss of potassium. Tell your doctor if you have heart problems, extreme fatigue, muscle weakness or spasms, tingling, or numbness, and make sure to intake more potassium-rich foods such as bananas.
Now that Cody and Tracy have told you about indications, adverse reactions, and when to notify your physician, I'm going to tell you about the route that is usually taken. Now, as you can see here, the oral route, the PO, that's a preferred route. They do offer an IM and an IV. They say that PO is preferred. Can be taken with food or milk. This is because it does lower any chances of GI distress. If you don't get any GI distress, then I wouldn't even worry about that. I would just take it with water. Tablets can be crushed with furosemide slash Lasix. Um, you might be asking yourself, is there some administration considerations? There definitely is. You want to make sure, since this is an oral medication, that your patient can swallow, so have them swallow some water first for you. Assess for edema. You want to auscultate the lungs. You want to check the upper and lower extremities for any pitting edema, cap refill, or any turgor up here on the collarbone. the multi-dose regimen for a patient is something that the nurse would want to know about. You wouldn't want to give anything past 5 p.m. So if you're giving them 2-dose regimens or a 3-dose regimen, you'd space that out so that your last dose is given before 5 o'clock. And that is so that it doesn't mess up their sleep cycle, because I have to be going to the bathroom all the time. So the diabetic patient, there's a thing to watch for them. If you know they're a diabetic patient, that they're going to get more CBGs taken. This is something that messes with the blood sugars. It raises the blood sugars. And then prior to a dose, we're going to be taking a blood pressure and a heart rate. Now, the medication lowers your blood pressure, so that's something we want to be highly aware of. So if you see here, if you hit 100 of a systolic, or if you hit under 100 for a systolic for blood pressure, that's something you want to hold it for. You do not want to give that. All right, thank you.